right, let's call the meeting to order. Carrie's going to give an explanation of the history of the Children's Committee. And we do have our guest speaker, and go ahead, Carrie.
Hold on.
Cool. So this is the Brooklyn Children's Services Committee meeting. We are one of the subcommittees of the Brooklyn Developmental Disability Council. Our charge is to bring together everyone involved in the services for children with developmental disabilities. So that's educators, primarily that's parents, of course, family members, it's educators, it's service providers, it's agencies. We've been around for over 15 years. We've had, even before COVID, we were sort of in a transitional period. Our longtime chairs, we've had two longtime chairs, and the second longtime chair retired. And so this has been a transition process for us. We've traditionally focused on young children, and we've been looking for ways to focus on children, up to transition age, birth to transition age. And it's really great to see new people here. One of the things we've always done is a sort of symposium in the spring, and we haven't done that, but we didn't do it last year. We did the year before. And it's been on a variety of topics, everything from what is ABA to getting services, for your child, to co-sponsoring things with the transition committee, like the one we did 3 years ago on self-direction, supported decision-making and things like that. So, and then we've also helped both educators and parents troubleshoot issues that they're having with the various systems. So that's a little bit about what we do. Our numbers have ranged from a sort of core of about 4 to as many as 35 at different times over the years. So, as I said, this is a transition period for us, so we're really open to what other people would like to see the committee doing, as well as to continue doing the things we've been doing. And Teresa, is that you at
Yes, I was just going to say she's here now.
Yay!
Yes, finally was able to get on. Sorry.
Good, I can step back.
Yes,
They changed
Carrie
our
agreed.
server, and everything is like new. I'm sorry.
Yeah.
Teresa, before we introduce Jonathan, we should remind everyone the housekeeping rules, as we want to thank Carrie for one thing. She did mention about the committee, and I think, Teresa, we should thank Carrie really much, because at least it's giving everyone to know what the Children's Committee's role and all that beautiful responsibility.
Oh, thank you, Carrie. Carrie is a big support.
Yes.
My main role here is to be the oldest person around who's been here since the beginning at this point. Which,
No, I'm sorry,
happy
you're still young. We don't.
Carrie, you and I are old, so we get together because I kept coming in and out.
Hey, listen, I'm probably older than Carrie.
Okay, how old are you, Teresa?
I meant long-standing, not age.
How old? I'm 64.
Okay, you're 2 years older than me. All right, I'll give it to you this time.
All right.
And now I'm feeling like a baby.
Yeah.
You are.
So I'm the old lady.
Well,
And I'm this. No, really, the oldest is Ann. Let's get on with this.
let's
Excuse me just a
remind it.
minute.
Yeah.
Saying.
Let's remind everyone who's on the phone. That's at Teresa. If you're on the phone at the same time, please remind yourselves that it's very easy to please *6 to mute or unmute. Again, on your phone, you can *6 to mute or unmute. If you have a question and you're on the phone, *9 to raise your hand as you see this hand, or you're hearing my voice saying, raise your hand. *9 to raise your hand. People on the screen, which Jonathan knows this already, so I don't have to remind some of us, but it is important to anyone has questions for the speaker, or when we're ready to do any other business later on, please make sure that you have on your manual participant page, which you see there's 14 people participating. You click on that and you will see a hand. Click on it and your name will be shown that your hand, it means you have a question. Please make sure you use that. Or if you're on the computer screen, you can also press the LAT, which is near the base bar. Press that and letter Y, and your hand will be shown the same way I just said. So that is the housekeeping rules. Right now, everyone should be on mute except the Carrie or Teresa, as well as I am, because I am recording this meeting as we speak. So please remind yourselves that this recording is available on the YouTube page. So, Teresa, Carrie, it's showtime.
Okay, so I guess that we'll begin with our speaker, Jonathan Novick, from the Mayor's Office for People with Disabilities and Community Outreach. So welcome and thank you for attending.
Thank you very much. As always, thank you very much for all the work that everyone does on this call. Chris, Debbie, Carrie, I think I've got to know you pretty well over the last few months, and happy to digitally see you very frequently in multiple occasions. So thank you so much for all that you do and for all of the opportunities you provide our office to help get the word out about what we're doing, as well as understand what issues are arising in the community that we might not be aware about. So for those of you who don't know, my name is Jonathan Novick, and I'm the outreach manager for the New York City Mayor's Office for People with Disabilities. Our office works to ensure equal access to everything New York City has to offer. That is, during what we call blue skies, which is, pre-COVID times. That's housing, employment, access to benefits, but, fun things too, Broadway shows, our beautiful parks and cultural institutions, and all the things that make New York City such a great place to live and visit. But of course, we're still doing all of these things, but now a lot of our attention is focused on COVID, on reopening, on discussions about vaccine distribution and how to include the disability community. So we're working on that. So I encourage you or anyone who to just take down the following information. If you have questions, if you're a person with disability or you work with people with disabilities and you have questions you'd like to reach out to our office, you can do so in numerous ways. And I'll put this in the chat, and Chris, I'll send you an email later that you can forward to everyone, because I know not everyone has access to the chat. We have some folks on the call as well. So our voice phone number is 212-788-2830. That's 212-788-2830. Our video phone for a program called ASL Direct, which is a video phone that serves deaf New Yorkers who prefer to communicate in American Sign Language. That number is 646-396-5830. That is 646-396-5830. And you can also visit us on our website at nyc.gov/disability. That is nyc.gov/disability. And I'm just going to put all this in the chat.
Thank you.
Thank you, Jonathan.
And don't worry, I got more. I'm just
I know.
pausing to pace myself. Let me see here. Okay. So we have a monthly call with the disability community where we provide the latest information on COVID-19, reopening, and other information. We have representation from NYC Health, Emergency Management, and HRA. And during this 1 hour period, much like this, we hear updates from our city agency partners and then field questions from the community. This call takes place on the first Friday of every month. We just had it last Friday. We had to make an exception because of New Year's. Happy New Year, everyone. But our next call is going to be Friday, February 5th at 1 p.m. If you are interested in joining, or if you'd like to get the word out about this call, I'm going to put the registration link as well as a phone number to join our Zoom call in the chat. So you can either select the link and register, or just dial in. You don't need to register. We understand not everyone in the community has internet access, and they can join and interact and ask questions in the same way via phone. So that is also in the chat. So MOPD, the shortening acronym of our office, is working closely with the Vaccine Equity Task Force to ensure the process of vaccine distribution is accessible and inclusive for people with disabilities. We have been constantly having conversations regarding physical accessibility of the hubs that are being set up, digital guidance on, communication materials that are being put forth by health on the website, on their online resources, as well as just understanding the needs of people with disabilities and trying to discuss from a interaction standpoint how to best assist people with disabilities and what some of the community's needs are, if they're not already being addressed. Now, as everything is getting setting up, and we're working on answers for many of the community questions, for example, the most popular, when can I get it? Unfortunately, a lot of this is coming down from the state, or not unfortunately, but just as a matter of fact, a lot of the hierarchy decisions are coming down from the state, and our job right now is to understand what is coming down the pipeline and to best prepare for it in a boots on the ground scenario. And as this information is coming forth, and as we are doing the best we can to pull out the relevant pieces for our community, I encourage you all to take a look and save the following links that I'm about to share in the chat. So first, there's the New York City Vaccine Command Center. That link is nyc.gov/VCC. nyc.gov/VCC, as in Vaccine Command Center. To keep an eye on the eligible groups that are currently, able to sign up for the vaccine, and to get an understanding of who is available or when you might be available. You can visit, putting this in the chat as well. Oops, sorry. You can visit nyc.gov/COVID vaccine distribution. That's nyc.gov/COVID vaccine distribution. For vaccine site locations, for eligible New Yorkers, you can either you can visit vaccinefinder.nyc.gov. That is vaccinefinder.nyc.gov. Or you can call 877-VAX, that's VAX, 4, the number 4, NYC. That's 877-VAX, 4 NYC. Numerically, that's simply 877-829-4692. And finally, or nope, not finally, we also have a COVID-19 eligibility flyer. Unfortunately, the hyperlink for this is way too extravagant to read out accurately, so I'm just going to ask that Chris and Debbie please send that out in an email. I'll send you an email later with this information.
Yeah.
Thank you, we will.
And the same thing goes for the latest vaccine fact sheet, what New Yorkers need to know about COVID-19 vaccines. So I think that's, I'd say, the most relevant information. At the moment, we are working on assembling a town hall, a virtual town hall for the disability community surrounding vaccines. We currently don't have a date for it, but as soon as we do, we will be sharing this information through our social media channels, on our website, listserv, so on and so forth. And I encourage anyone who has questions directly or wants to know more about our office and what we are doing, you can either ask them now, but of course you can also contact me. My phone number is 212-788-2856. That's 212-788-2856. You can also email me at jnovick@cityhall.nyc.gov. That's J as in Jonathan, N as in Nancy, O as in Oscar, V as in Victor, I as in Igloo, C as in Cat, K as in Kansas at cityhall.nyc.gov. So at this point, I just shared a lot of links and information, but I just want to pause and really just open it up to all of you. If you have questions about things I covered or didn't cover, Doris, I see your hand.
Yes.
Yeah, Jonathan, before we do Dolores, we do need to check if Teresa, do you have questions to chair first of the committee?
I just had something to add, and I'm sure that people are aware now, but school staff are now able to, they're in the first grouping to get the vaccination. So is there a number, or can they contact, especially staff working with very high needs children, that they could get vaccinations from your office?
So our office is not directly creating, overseeing or setting up those sites at this time. This is coming through the Department of Health and Mental Hygiene, specifically the vaccine command centers. So as far as a phone number goes, you can call. I would recommend calling the phone number for the site locations for eligible New Yorkers for guidance for schools, I would say, so for teachers, and they should be able to assist you and point you in the right direction. And that number once again is 877-829-4692, 877-829-4692.
Okay, thank you.
Yeah,
Carrie, do you have one? But before I do the next person.
No, I'm good, thank you. And it's just great to have all this in one place, Jonathan. Thanks so much for coming and sharing it with us all.
Very welcome.
And all these numbers are on your flyer, so we can share with our families?
Let me see.
They're also going to be on the chat too, because Jonathan does send a mailing out, Teresa.
Yeah.
When the meeting, once he sends out a whole list, I will make sure I send it to you as well.
So a lot of
Okay.
these services and a lot of questions really just fall back onto 311. You can call 311, and you can also text 311. I understand wait times can be tumultuous, so texting can also be very helpful in getting information. You can text 311-692. That's 311-692. 692 is just NYC alphabetically. I'd recommend for additional information and questions as they come up, direct there. Yes.
Okay, one more.
Go ahead.
I heard on the news last night that when you register for the vaccination, that it's very complicated and it's difficult for people that are not computer savvy. So is this for people, individuals with special needs? Do they have this same form they have to fill out? Or
So
is it?
Okay. So appointments are available, online at nyc.gov/vaccine finder, but you can also do it online at the number that I provided before. So that should help with the process, both with the complication. It should be simpler, yeah. So somebody can actually assist you with filling out the form, whether you're having trouble with it or you don't have internet access.
Okay.
Okay. Dolores, Donna's
Yeah,
go ahead.
yeah, actually, what Teresa said just leads to my question. I wanted to know, like, what phase, like, I know the vaccine is distributed in different phases, so what phase are we at now? And that for someone living in a residence, would they be eligible now?
Yes, they are.
They are eligible now. That's, I just.
They are eligible.
Individuals-
OPWDD has a list of what is going on. So Doris, you need to go on the OPWDD website.
Okay.
Sorry to interrupt you, Jonathan. It's just that as chair of the advisory, and I'm getting statewide also, member of the statewide, we've been getting I get every day an update from OPWDD. They have the list of how it's being distributed to our
Their residences. Okay, thank you.
Yes. Thank you very much. Yes, individuals in congregate settings have been able to get this. OPWDD is one of those congregate setting groupings. We are currently in phase 1B. This includes individuals, I just lost the page, such as healthcare workers, essential workers, sorry, wait, hold on one second. Teachers and education workers, individuals who are 75 and older. I'm reading directly off the flyer currently that was just shared by me. First responders, public safety workers, public transit workers, healthcare workers, and staff with direct patient contact, dentists and staff, pharmacists and pharmacy aides. So for the most up-to-date list, you can visit nyc.gov/COVID vaccine distribution. So that is the latest in terms of eligibility.
Thank you.
Thank you.
Thank you.
Anybody else
Thank you.
has questions for Jonathan?
Teresa?
Oh, good.
Hold on. We actually have actually, Jonathan, you have another hand up for someone. Michael, who is from the State Senator Roxanne. Go ahead.
You should be able to unmute yourself.
Okay, I hope you can hear me. Good morning, everybody, and thank you all for everything you do. I was just wondering, Jonathan, if you could just share some of your experience regarding developmental group homes and the whole developmental community as to how they're faring overall with COVID. Is their experience better or worse? Or I see I see a visual from Carrie Banks as to what that is, but I'd just like to hear from the panel and then Jonathan and then perhaps Carrie as to what's going on really, so I can let the senator know.
Tell him.
Thank you
Of
all.
course.
Jonathan, this is Chris. I'm sorry to interrupt, but Michael, this is Christopher Gripe, Vice Chair of the Brooklyn DD Council. Deborah Gripe can also answer that question because the information, as Deborah is the statewide member and does represent OPWE, between Carrie, Jonathan, as well as Deborah Gripe, Chair of the Brooklyn and statewide, we can always give you that information, which is available. And Deborah does have a report on that later on also. So I know, Jonathan, you want to answer that question, and I know.
Sure. I would actually defer to Deborah. We, of course, have been working with Deborah and Chris and Carrie, having our what was a weekly call regarding COVID and trying to provide resources wherever we could. But as far as a up close and personal update on congregate care settings and those locations that serve people with developmental disabilities, I think the best information would come directly from Debbie and Carrie.
Okay.
Thank you.
To answer your question quickly, I'm not going to go through the whole report. Every week, the chair of the statewide, Mrs. Margaret Puddington, goes through what the updates are. We know how many people have unfortunately passed away, and that includes individuals and staff, and how the vaccines are being distributed. If you need further information, you can go onto the OPWDD website, or you can go through the Advisory Council's website, and I'll give that to you right now. www.B as in boy, F as in food, S as in son, another S as in son, A as in apple, C as in cat.com. There's a link that will put you right through to all updated reports for the OPW group homes and other services and reference to COVID-19. If you're having trouble, you can call us after this meeting. My cell number is 718-954-0734. Okay? Did that answer you at all?
Very much so. Thank you so much, Debbie.
You're welcome.
Thank you.
And Carrie,
welcome,
you
Jonathan.
want to add any bonus? Because I love when it comes in bonus.
Sure, Michael. I'm Carrie Banks. I'm with the Brooklyn Public Library. I run our inclusive services, and those are services for children and teens with disabilities. And I sort of see a very different side of this. People call us for help when they don't know where else to go. And we're seeing sort of the cascade effects of COVID. So we're seeing a lot of adults or people who've just aged out into the adult system who are not getting services. We're seeing lots of problems with particularly students who are in general education general education settings getting special education services, not getting their services. Families are really struggling with behavior issues at home, with routines that have been disrupted, particularly for children with mental health issues and also autism spectrum disorders. And then we're also seeing just the enormous amount of increased frustrations at home that are and developing mental health issues throughout the disability community, not just in the developmental disability community. And these are the things that people are coming to the library with questions about, or coming virtually to the library with questions about, and that we're addressing in some of our programs. But those transition times that are difficult at best in terms of dealing with systems have just become impossible. The school age transition from early intervention to school age programs, the transition from school age programs to, from preschool special education to school age, and then also and very importantly, the transition from school programs in general to adult services. There's just lots and lots of difficulties there. And some of it is, some of it's preventable and some of it is just the way the world is now. But yeah, people are really struggling. So thank you for asking.
And this is Teresa. My perspective is in the education field. And what we're seeing is a lot of children are not being evaluated because in the Board of Education, the CPSEs and CSE staff are working from home. So parents, they don't have their emails. So when they're calling these offices, there's no one to answer the phone. So we're getting the calls and we're emailing the districts, but it's very slow. Our enrollments are very low. My school normally in September has 179 preschoolers. We started the school year with 108 children. Children were not evaluated. It's just starting. It started in the late fall, and we're starting to see a pickup, but many of the preschool providers cannot survive, so they're cutting out classes and programs are closing. Our 853 schools, that's our special needs schools. Preschools are 4410. We're not able to survive. We're paying rents and we're not getting tuition. So the virus has really hit, but it's really the children and the families. Like Carrie, I get calls all the time, and even though we're a preschool, I get calls from parents who have 8, 9, 10-year-olds, and they're struggling on how to get services for their children.
Carrie, you had your hand up?
Yeah, I did. And I'm sorry, I left out something that's really important. And that's that what COVID has really shown us is the huge disparity in digital access. So the individuals that we work, the adults, for example, our self-advocacy group that meets at the library, Voices of Power, it's been really difficult to get them together because they don't have access to the internet. They may have the devices, but they don't have internet access. And that's a huge problem with the schools too, that the children, that they may or may not have devices, they may or may not have gotten them from school, and lots of them didn't. But even so, they don't have internet access at home, or they don't have good enough internet access at home to reliably go to school, or for their parents sometimes to reliably work, or to do both at the same time. The library has been expanding our free internet access by expanding our networks based at our libraries. It's a slow process, but it's going well, so that people can access internet outside the libraries, which is not ideal in the winter, but it's better than nothing. But it's just a huge issue, and I can't underestimate it. As Teresa was saying, it's hard to go through that transition process if you don't have access to the internet. It's hard to book a doctor's appointment if you don't have access to the internet. You can't go to school. You're even more isolated than otherwise. So it's just really brought that to the front in a way that, you know, many of us have been paying attention to for years, but I think is now evident to the much broader population. So, okay, and I'll stop now. Thank you very much.
No,
Yeah.
actually, Carrie, Debbie's going to chime in with you as a double team.
Okay. As chair of the advisory council, what we have seen, first of all, most of our children are on SSI unless one of their parents is either retired, became disabled, or passed away. Then they collect under their parents' social security number. But the problem is these parents have to figure out, do I pay rent, eat, or have internet? And also, a lot of their children are adults because the advisory council represents anyone who is from birth to death. And we, even when the individual passes away, the advisory council will still assist the parent, and we welcome their advocacy. But the problem is that the amount of money you get for food stamps is very minor, not enough food programs, and also they think of internet as a luxury. Now, most of our children have trouble reading and writing and also tracking. So internet or having a laptop or even doing it on a tablet or a phone is a lifesaver, but it's not looked at that way. It's looked at that there. It's a useless tool, which is, it's not. I'm not saying it, but this is what's been told to me by many families who are very upset, and even the self-advocates have told me this. It's so hard to budget. People can't figure out what to budget right now. So we need the elected officials. Michael, your boss is a great advocate for us. And Nicole, everyone has been there for this population, but this is the important thing we need to do. We need one advocacy for preschools, much stronger, because they're not funding them correctly. Internet access for anyone going from school all the way up, and changing how food stamps and other benefits are given to families or individuals with disabilities. It's very archaic. You can't even register or do it online.
We have another hand up. Sandy Naper.
Hi, Sandy. Where are you?
Sandy, you have a question for Jonathan? Sandy?
Hi, here I am.
Yeah, I can hear you.
I was just wanting to kick in something about access to internet. I heard there's something that's going to be in the state legislature that they may be voting on a bill that will allow free internet access to all students until the pandemic is over. Did you hear anything about that?
Now, which person are we asking this? Jonathan or Michael?
Michael.
Michael from State Senator Roxanne.
Yeah, good morning. I personally haven't heard about it, but I'll inquire. To get back to you, how would I do that?
Contact me and I'll get it through back to Sandy. Sandy happens to be my recording secretary in the advisory council.
And we can, if you get that information to us, Michael, we will then forward to Sandy, and we will also make sure Teresa, Carrie and Jonathan will make sure we share that information.
And I want to add one more thing. It should, if we do, it shouldn't be free until the pandemic ends, because the parents are still going to be financially in distress. So this should can go by, if you're on SSI, SSDI, you should be getting it for free. It should be included.
Okay, Jessica from Tri-County, your hand was up. Do you have a question for Jonathan?
Hi, good morning, everyone. This is Jessica from Tri-County Care. I do have a question, but it's regarding Article 16 clinics. I hope that...
Jessica, this is a question for Jonathan Novick, who's our speaker, because we're only doing speakers, right? We're trying to focus on the speaker about information.
No problem. All right, I'll just wait.
Because we're not up to the announcements yet.
No
Bill
problem.
has a question for Article 16 clinics.
Just let me answer this question. Is this related to Corona, as Jonathan mentioned earlier?
The question is related to getting it's autism evaluations. I wasn't sure if that was information that I can get from Jonathan, but I was just going to post the question anyway.
You can put it on the chat, and Jonathan will definitely get it. But we are saving that announcements later on.
Well,
No,
that
I'm
question,
That question.
but one thing I will tell you is, we need to check the Article 16 clinics because right now everything's way behind because of COVID.
right.
Yeah, and that is a good timing that part of it is being mentioned because Michael, as you've been hearing, one of our CCOs has just brought up to us a lot of the Article 16 clinics are a little backed up a little bit, and families need to make sure they go see their doctors. As you know, a lot of disability groups do visit Article 16 clinics like YI, HRC. If I mention every agency, HeartShare. The main thing is since Roxanne now is part of that Development Disability Committee, we do need to make sure that Article 16 clinics are getting the necessary help.
Excuse me, Jessica, you should really be giving that question to
Michael.
No problem.
not Michael too, but also to the Care Coordination Committee meeting, which is tomorrow.
Save that for
Yes.
a good thing.
And Michael, you're more than welcome. Jonathan too, if you want to. But the Care Coordination, they're the ones, because we're gonna have people also from HRA, so you can bring that up.
And Jennifer Schultz will be there
Thank you.
tomorrow.
Yes, so I want to make sure you get the correct answer.
Yes.
Okay, thank you so much. All right.
No problem. Does anyone else have a question for Jonathan Nowak or any other? Teresa?
No, I don't. Thank you.
No. Teresa, you're the chair, so why are you saying no?
You asked if I had a question.
No, I just said Teresa, making sure you're there.
Oh, nope, I'm here.
Oh, Jonathan, you still here? Because Jonathan, in reference to when you make a complaint to 311 through text, has MOPED been getting them?
We have. It depends on the complaint. If it's regarding, let's say, accessibility enforcements for open restaurants, that would go to DOT. It goes to different places depending on the complaints.
Okay, that's what I was just curious about. Thank you very much.
Yep, no problem.
So, wait, Jonathan, I have another question.
Go ahead.
So if we have families that have children with physical needs and they live in public housing or and they need more they need lower floor apartments, or is it also 311, or can they contact someone directly?
So we have two different housing coordinators in our office that would be able to assist. While we don't have any, we don't control units, but we do provide advice and advocacy in terms of directing you to, the options that are available, whether it be a person with a physical disability looking for an accessible apartment or looking to move. We do have one program. Unfortunately, it's closed to COVID. It's called Project Open House, and it's a home modification program for people with disabilities across the 5 boroughs. If you want to learn more about that program, you can visit nyc.gov/POH, as in Project Open House. That's nyc.gov/POH. As I mentioned before, it's currently closed, but we can still try and assist you in terms of providing guidance for you. So I'd recommend you can either shoot me an email and I'll connect you, or you can call our office at 212-788-2830 and then press 1 for our housing coordinator.
2830. Okay, thank you.
Yep, you're very welcome. Thank you.
Yeah, Carrie Banks, raise her hand.
Hi. I saw an announcement last week that Adapt Community Network has openings for home modifications, and they're still doing them now. So if it's a question of a home modification, you might try Adapt Community Network.
Okay, thank you.
All I can say is this is a lot of teamwork in this meeting today. This is a nice, fresh meeting, teamwork. I love the smell of it. I think Carrie and Teresa, you both agree with me. A lot of teamwork in this meeting.
Jonathan, can you
It's been a
assist?
very helpful.
Teresa, Jonathan, is your office able to assist for when parents who have children have IEPs and they're having trouble getting their IEPs or services? Do you have education advocates, or you refer them to an education advocacy group?
we refer them to education advocacy groups. We do have contacts within DOT that we would all, or sorry, DOE that we would also connect with. But yes,
Thank you.
you can reach out to us as a starting point.
I appreciate that.
Does anyone else have a question for Jonathan? Okay. Okay. I will say one. And
Actually,
then
sorry, Chris, can I just make a quick announcement on a resource that I think everyone would benefit from, if not already in knowledge of? So we have a program in the city called Disability Service Facilitators. So this has been around since 2016. Every city agency, that's Department of Education, Department of Transportation, HPD, Human Rights, NYPD, you can go on, is required to appoint one person as a disability service facilitator. This is a point of contact for the disability community, but also a position that, provides the responsibility that they ensure access within their city agency and their work. All of their information is listed publicly online on our website at nyc.gov/DSF. That's nyc.gov/DSF. So for similar questions or just for everyone's awareness, I'm just putting it in the chat now. But that's nyc.gov/DSF. So that's additional city points of contact for disability-specific issues.
What happens if the agency doesn't have a person? What do we do then?
It depends on the well, they all should. So I guess tell us what agency doesn't have a person.
I don't know yet, but just in case I call her and I'm given the wrong runaround, not just me, others, and I get the complaint, I'll know what to say or do.
We'll reach out to our disability service facilitator. Her name is Noelle Haight. She also runs our ASL Direct program. So let me see. And she oversees the New York City Mayor's office in terms of like the other offshoots. So for if there's an issue with the Mayor's office, if there's an issue with Immigrant Affairs and other, mayoral offices, you would contact Noelle. But she also oversees the disability service facilitators as a whole. So I'm just going to put her information into the chat.
And after you do that, one more question reference that. All right, if the, now you just said this is for city agency, but does that include the controller's office, the public advocate's office too, borough president's offices?
It's for city agencies specifically. So it doesn't impact, although there might be some, city council members that you can reach out to. Some, agencies might have ADA coordinators. It varies, but this law specifically mandates city agencies.
So, okay. And that also includes community boards, right?
It does not include community boards. It includes city agencies. So housing preservation development, HRA, social services, Department of Buildings, NYPD, the fire department, those New York City agencies. It's not mandated of city council members. It's not mandated of those other offices that you mentioned. Although, we would encourage it, but for this specific resource, it's all city agencies.
All right. Thank you very much for the clarification. I appreciate this. Yeah, Teresa, are you there? Chair?
Yes, I'm there. That was very helpful. I actually wrote down a lot of information to make a flyer to send out to agencies. So
yes,
thank you.
and Teresa, just to let everyone know, since it's on the chart, it's on the chat, I'll be sending this information to Teresa, and Teresa will forward it to everyone on the Children's Committee list as well. So,
Okay.
for the final one time, does anyone have any questions for the young, handsome,
And majorly intelligent.
thank you, I'll let her say that, Jonathan Novick, because let me say this now, even Carrie, who can vouch with me, he is I call him the 411 information. He did, let me tell you, he even helped a lot of people, even with even dogs, pets, faster than FEMA. And I can say, because Edith already said I have to say, or,
Yes.
she'll hit me from the other end of Manhattan.
And also, Jonathan, we thank you for all your help personally. That's all I'm going to say to us.
Yeah.
We appreciate, because Jonathan, we need to clone you, because you are an excellent community outreach person. You do hear us and listen, and I appreciate it. So does Edith, because she said I have to say that too. Okay.
Well, thank you very much. Thank you very much. And we wouldn't be able to do what we're doing if it wasn't for everyone here. So thank you very much
You're
for being
welcome.
here.
And Teresa, you there?
Teresa?
I'm here. So I'm just going to give a little update on education and what's going on.
Mhm.
Like I said before, school staff is now able to get vaccinated. And I actually had 3 staff that received vaccinations yesterday. So that's very positive. Also, I've mentioned, but I want to repeat that referrals and evaluations were moving very slow this year. And even though it's starting to pick up now, especially with children turning 3, I've gotten referrals for kids that are 4, and parents tried for months to try to find or get in touch with CPSC. And that's a big issue, because even though school staff are in the buildings, in the Board of Ed, those working in offices, the CPSC and the CSC staff are working from home. So it's difficult to get in touch with them. There's no way to call them. You have to know their email addresses. They have difficulty scanning and sending and receiving information. So when we do get information from for children that are going to enter our programs, we're missing a lot of paperwork. And to be honest, a lot of the information that I got from children for their files, their evaluations, came from the parents. We're having in the schools a difficult time with a lot of the districts, and parents are having even worse than what we're having. So that's an issue that what our programs have been speaking about to the interagency council and the coalition. We're advocating to have those people back in their offices. And just to be fair, there are a lot that are working and working late hours, but there are others that it takes days. I had a child that was supposed to have a meeting and start, and we're waiting over, it was the end last week of program before the winter break. So we're waiting December for paperwork. Also for preschools, they started with this comprehensive background check last year in September for all new employees. And now they're beginning for existing staff. It's meaning that they have to be re-fingerprinted. And our staff already has 2 sets of fingerprints. And the cost is, I believe it's $130 or $135 for the fingerprints. The Board of Ed will be paying for all the pre-K for all children. And we're advocating that they also give funding for the 4410 program, because our children are Board of Ed children. What else? And the last thing is that if, I don't know if people have been aware, but a lot of the preschool programs are closing or sizing down, closing classrooms. And that's a real heartache for parents, because there's less and less programs and less services available. And that's my education update.
very, very sad, dismal.
It's
Have
very
you,
sad. And actually, the school age programs also. Our
yes,
agency, the program in Staten Island, and it goes from pre-K till 5th or 6th grade. And we have 6 children. We're not getting the referrals. Their districts aren't working with the children that are sitting home with no program. Uh, it's just this year is going very slow. A lot of children are sitting home. I just started 2 children. One is entitled to preschool until August, but he's turning 5 next week, and he has not received services since early intervention. So and the other child is also a 4-year-old turning 5 this year. And the parents started evaluations in February, and he just now is getting services. So
excuse
it's
me,
been a sad year for many.
Teresa. Teresa, this
Yeah.
is Debbie. Have you instructed and helped these parents? One, they have to document everything that's been happening. And 2, you need to make sure that they should go for impartial hearings because
A lot of impartial hearings are happening.
encourage them, and that's what you must do. But the parents also, as well as you both, have to have it documented, writing it down. Like my child was supposed to start services. I used to, when Miss Mine was in school, if they didn't give him the service, I said, well, no problem. I'm ready to write the impartial hearing up. I was trained by a lot of older advocates, and I followed. So I hope you do that. Michael, please get this into
Yeah,
state
we
people.
really advocate for the parents, and we have a lot of in services. We work with the library,
Yeah.
with ADAPT. Also, I'm part of AHRC. We work with our advocates, so we really train our parents. And I've gotten a lot of calls from parents of past students that are now going for impartials for loss of services.
They have to do that because if you don't document it, because if say, okay, services start, but the child is so far behind, then they have to be given eventually the compensatory services, even if they're 21.
Carrie has a question.
Actually,
Yeah.
I don't have a question, but this committee is sponsoring a workshop on special education issues, and I thought this would be a good time to talk about it. Is that all right, Teresa?
Yes, it's perfect.
Okay. So Teresa and I have worked with Scott Mesh, who is the co-founder and CEO of Los Niños Services. And he's going to be doing, I put all the information in chat. He's going to be doing a workshop on March 2nd from 4 to 5 on special education for young children, 10 questions and answers. So he'll be answering questions like, what are their parents' rights? When children should be evaluated? What are the risks of waiting for evaluations? And the question of labels, the ever sticky question of labels, and the reluctance of some families to get services because they're afraid of labeling their children. And he'll take questions from the audience. This will not be recorded because there will be issues of confidentiality with parents on the Zoom meeting. But we really need your help in sort of getting this out to a broad community. We want to reach families who are thinking about having their children evaluating or having questions. Families of young children who have questions about what services are available or if there's anything going on with their children that they should get services for. So Chris, I will send you all the information. We just finalized this the other day for the website, but please, let's think broader than our normal networks, because we do want to get past or beyond the people who are already getting services to the people who may need them, children who may need them and are not getting them. So,
well, I think
you help us get the word out.
Carrie, also we'll send it out, but I also suggest that you send it to the borough president's office and all the elected
Oh, of course.
because I know, but the reason we have to also, if you know, you're able to show up before March 2nd and ask for a public speaking in 2 minutes, they do give you 2 minutes. This can be announced in more places than you realize. So,
Yeah, we'll take it to community boards through the local libraries. Yeah, absolutely.
Right.
Ooh, nice move.
because that's
Thank
what
you.
I've suggested, many others do. And if you also know a civic organization,
Sure.
send it to them.
Yeah, oh, no, we do. And I will, and we
I know you
do.
I know you do.
And
But I
before-
just wanted to reach out to this particular group with the expertise that we have in the room.
And I have to say one thing, Carrie. Actually, I'm glad you bring, because on the agenda it says Carrie Banks.
Yes.
Yeah,
You're supposed to
and
bring
this is
that up.
So in one way, you came right into touchdown.
good. And this is, this is the event that's sponsored, or an event that's sponsored by this committee. We'll be doing more of them too. But this is our inaugural event, more or less, for the year.
And I have a suggestion. He's doing the 10 points, but I think we need to eventually do a separate workshop of what labels mean or don't mean for children
Okay.
who have disabilities.
Carrie, Michael has a question for you.
Yeah, of course.
Michael, you're still on mute.
We have to unmute you.
Not you can't. You're still on mute. It goes quick on this. There we
I
go.
hope that's better. It
Yeah.
actually wasn't a particular question. It was just a comment on something
Yeah.
that Debbie said before
Yeah.
when you were singing properly. So your praises for Jonathan. Remember,
Yeah.
he has an employer, and it's called the mayor. So if you think he's doing the job you told us all, let his boss know.
Yes.
We do.
We do.
Thank you,
We
Michael.
speak to Commissioner Victor, well, let me say it correctly. Commissioner Victor Calisi, who's now also on the
Speaking of Jonathan, he's right
MTA board. And
No,
Jonathan
no,
will
I'm
tell
here.
you, every time I see his boss, I tell his boss, one, he needs a raise, and two, he does such a fantastic job, and you better treat him well. And he knows I say that because I've been photographed and filmed by reporters hearing me say that.
Good.
So I do that all the time. He does this.
And he's blushing.
And right, Jonathan, am I telling the truth?
You definitely are telling the truth about the fact that you said this before. So thank you very much. But I think everybody in our office works hard, tries to do everything. Victor Calisi, I only learned everything from him, quite frankly. So it's thank you very much. Yeah, and
But
let's
Jonathan,
just
you
get
know
through this.
everyone actually enjoys when you do the meeting, and Carrie can vouch with me. When you do the meeting, you control the crowd. You give them the confidence. And I said this to Victor, and Victor agrees with me. That's what we need to see is confidence, stay mighty, and just find the information that we can keep everyone stay healthy.
We've always appreciated because whenever I've asked you to assist our population or others, you've been there. And if you can't, you find someone who can help us.
Yeah.
So Michael, we do. I know that I know Jonathan super long, and I could just say he's helped me on more than one level, which I will not mention because it's confidential. But he knows what I mean.
Yeah.
Nice.
My comment was never to suggest that you were shy and
I'm not ever shy.
and had an issue coming out of your shell, but I just wanted to.
Yeah.
No. But now you got everyone laughing
No, I
about
just
it.
wanted you to be like you sometimes see me very quiet at the community board because one, I have to follow protocol and rules. But give me a chance to talk, forget it. Then I open my mouth.
Forget about it.
Another question from Allie.
Yes.
I know Allie's hand was up. That's why it was because I know.
Allie, you there?
Allie, go ahead.
Yes. Hi, can you guys hear me?
Now
Yes.
we can.
You have a question for
Hi.
Carrie?
Anybody?
Yes. Yeah, I actually have a question for Teresa and Carrie. I was wondering if they would be open to sharing their contact information.
Oh, absolutely. I put mine in the chat earlier. I'll put it in again.
Okay.
And Teresa is Teresa's information is also available Okay, who's barking saying the truth?
Putting it in the chat.
Okay. Carrie, is that you?
No. Just
Oh.
have Allie, is that your dog?
That's my little puppy. I'm
Yeah.
sorry about that.
That's okay. That's
Teresa,
okay.
I'll put your information in too.
Yeah.
Thank you, Carrie.
That's not a problem, Natalie. We'll make sure you get that information. And Teresa, Carrie, if you can write Teresa's information.
I will. Yeah.
She will.
Okay.
Thank you, Carrie.
Thank you.
I just want to. I also just. Is it okay if I? Is it okay for an announcement, or are we not there yet?
We're not there yet.
Okay. Okay.
But we'll get back to you, I promise.
We'll get back to you. As I know a lot of us in these agencies are not leaving because I want to hear announcements too. But I do have some very important information, as well as Debbie has her report as well, which I know Michael's dying to hear, as well as Kathy, if she's still here, and other people. But does Carrie have anything else to add on her end?
Not on the committee. I do have some announcements later on.
Yes. But okay, so let me go to then. Let me also. I'm glad I'm seeing everyone's. I love when you guys put this chat. It makes it easier to copy and paste. Yeah. Let me get to my bottom piece. First of all, let me move this over a little bit. Sorry. There we go. Okay. Teresa. Debbie has a really good, some good news and strange news report, and I'm saying in all three directions.
All right. As you know, Margaret Puddington represents the Statewide Advisory Council at the COVID stakeholders meeting. Now, I'm going to go only into January because I really don't want, because it's all added up there. As of January 6th, 6,937 individuals were confirmed positive, including 5,266 in certified residents. Sadly, 538 individuals passed away with the same demographic trends as previously. We have 9,300 staff confirmed positive. The confirmed cases and hospitalizations have increased slightly in the past weeks, as with the general population. OPWDD is considering whether additional prevention strategies are necessary. There will be discussions and talking about visitations should be restricted again while waiting for protection to kick in from vaccination, and whether mandatory testing and vaccine should be required. Now, this is from the COVID vaccine, Roger Beard. Governor Cuomo announced an expansion of Priority 1A to include staff, but not individuals served who do not work in certified residents. Much discussion of the need to vaccinate medically complex individuals with IDD living in the community as well as their families or providing care. Roger stated the OPW is aware of this need, but including this group depends upon the quantity of vaccine that is available. The stakeholders who are on the call put forward a strong recommendation to prioritize this group. So they are collecting data and they're trying to push it through. Now, the other thing is there will be slight changes. This was brought by Kate Marley to our CMS. They're requesting changes to extend the effective date for the Appendix K to March 31st, 2021. Extend billing flexibilities in cases where programs need to close or reduce its population. A program could continue to count 2 hours of service as a full day and 1 hour of service as a half a day. Create a category of pandemic leave when visitation is curtailed such the family may take their children home from residences, and the residents would retain 100% of their pay rate with no cap on the number of days the person may be absent. OPWDD is hoping for approval within 2 weeks, hopefully. So let's just hope, because Kate Marley is an excellent advocate for us. She does work for OPWDD, but she does know how to work and how to talk and work with CMS. So in reference with that, parents who've taken their children home, well, I understand. And in reference, we just don't want the agencies to be forced to close because they don't get paid. They don't get the payment if nobody's in the bed. And yet they still have to pay for all the gas, the electricity, water, whatever is associated with residential living, or if they're in an apartment too. So we're constantly advocating to make sure agencies do not lose their funding. also because many families don't want to send their children in person, so many of them are doing it through virtual to do their having day services. So we're still waiting for more answers. When I get more answers, because Margaret right now I know is at a meeting with the state, she will get back and then I can announce whatever she asks us to announce. So that's my report.
Does anyone have a question on Debbie's report on statewide? Teresa?
Nothing. Thank you. That's very helpful.
You're welcome.
And just to remind everyone, more information will be coming soon. And I will say this, as you know, we are got to has anyone got a chance to listen to the governor's state of the address? It's important to you guys. You can still get a chance to watch that. You can just go on the YouTube and write Governor's State Address. I have watched it. Let's see what happens, and let's see what happens with the federal government with the funding as well coming up on that. Does anyone have any questions for Deborah before I move on? Okay, Teresa, I have a DD Council's report. This is ordered by Joyce Levins, chair of the DD Council, and this is going to all committees, so I'm making sure, Carrie, this is ordered by Joyce, not me. I'm just saying this because I just want the words, everyone else to hear the words, because she told me to say it. I'm just a messenger.
Go ahead.
Yeah, I like that word, Carrie. Thank you. As you may heard from another borough, it's not a rumor, but it's to be determined. There is a legislative virtual meeting coming up this Friday. This is just a virtual elected officials. You don't have to attend this one because it seems the other DD councils, because it depends if I'm going to say if Kathy's here because Kathy represents Staten Island. They're thinking of doing the 5-borough legislative virtual. I don't know what it's going to be called, but to me, it's not going to be pretty, and I'm just going to go play. And I'm being truthful. I'm not going to lie in this video. But this is a starting meeting that Joyce Levin will be hosting with us. When I say us, that's Deborah and us who's on this. We'll be on this Ring Central, and that is the ID number. As a reminder to everyone, it's ringcentral.com/join, JOIN. The meeting ID number is right here. Telephone number is right here. And the ID number is here, but make sure you always press pound when you're doing the phone.
And the time, you did say the time is,
No, the time is, you can come on at 12:45. The meeting will start at 1 p.m. So I'm reminding everyone this meeting should be like a 1 hour or half-hour meeting. I have no clue. All I know is from that point. Okay? Now, I did not put the speaker name in yet because I'm going to meet with her actually after this meeting. But this is something for everyone to suck their teeth into. Due to the fact that our president is getting sworn in on the 20th, the meeting was moved to Wednesday the 27th. You guys can get on by 9:30. The meeting will start at 10 a.m. And I'm just going to remind everyone, this meeting is a extra special meeting. We will have someone talking about the history of, say it.
well over.
Thank you.
Wow.
I knew Carrie was going to say that. I was ready.
Yeah. No, really.
No, I like the face.
So before we announce name and everything, we're meeting to talk with her what she wants us to put on.
Make sure, because I didn't put a topic in, but she will be joining us. So Carrie and Teresa, you guys do not have to do a committee report for this month's meeting. Your meeting information date will be shown on the screen, so give everyone a chance. So because the presentation will start at 10 a.m. and we're giving her at least 35 minutes, and then give her 25 minutes for people to have questions. And then by 11 o'clock, we then go into regular business, which will be the IAC report, the DDRR report, the chairperson's report, updating everyone and giving everyone reports that are coming up. And I will mention every other subcommittee's meeting dates that will still be on, and announcements. So that will be the agenda. So we remind everyone that will be an extra special. Please pass the word out. This leaflet will be changed a little bit. This is just what it looks like now. The meeting ID number is still the same, will not be changed. And I'm moving the screen so people can see it a little bit. So this is the meeting ID number, and as again, phone number and ID number. The phone number sometimes may change, but you know what? Still works. So again, the next general joint meeting, which is Brooklyn Family Support Advisory Council and the Brooklyn Development Disability Council, will be on Wednesday, the 27th. And in February, it will also be the last Wednesday because it's President's Week and everyone goes on vacation. And that meeting will be on February, the last Wednesday of February. I think that's February 24th. And IEC will be joining there. And that leaflet will be joined at the 27th day of the meeting. Remind everyone, Mass Force is still open. It's still open, asking anyone who wants to volunteer along the train stations or on the bus. And if you neglect someone on that picture, it's not just me, but it's someone else. I'll say he's from YAI, and he does help. Mass Force will be on January 27th of 2021. You can go onto this link here, which is right here. Sign up with the gnrius.com/go/mass-force. You can choose the station, but I'm gonna remind you, if it's in Brooklyn, it will be Atlantic Avenue. That covers almost 75% of Brooklyn. Broadway Junction, and I'm gonna say to be the others, and that's right now in Brooklyn. In any other areas in the city, it will be in Manhattan, Bronx, and yes, there is Staten Island for the St. George Tournament. So if anyone's interested, please make sure you sign up today. Now, I am going to be mentioning this to all committees because this is ordered by Reggie Barron. This will be mentioned. Coming soon, the reduced fare Omni will be coming in. We're reminding everyone to please, with the page 1 for seniors or people with disabilities, to please make sure that their addresses are the same, but an email address must be added in. If they don't, this will be a perfect time to help out, and this is for agencies, help them out to sign up an email. So that will be only for their Omni card. They can use it for other things or Accessorite as well, but they're asking everyone to please have an email address. Once the card is ready, that will be later this year, it will be announced soon. And all elected officials, and that's including Carrie and Teresa, will be notified as soon. And that's including the student passes will be also upgraded possibly this year or next year. More information will be available later on or in the next couple of months. The Advisory Council Outreach Update will have, and we're going to be doing a little education time, and I think Carrie will be interested in this one. We have Vanessa Laco, formerly used to work for Long Island Railroad Government Relations, is now the Executive Director of the Suffolk County Farm, which is very hard for me to say.
Cornell Cooperative Extension of Suffolk
County, which she's in charge of all the farms and education farms in the Suffolk County. She will be giving out some information as well. This will be a good opportunity to give everyone a chance to have a little education. And Reggie Barron will be joining with me to remind people if you're having trouble to update your card or any other information you'd like to ask him questions on. He will be there as well. But first it will be Vanessa speaking, then Reggie. So as a reminder, everyone, that is the next one will be February 3rd. You can come on at 10:15 and we will start at 10:30. That's all I have. I know Teresa, the next meeting for Teresa's meeting is February 9th. And Teresa's information is actually, I know somebody asked for Teresa's information. Nice and beautiful color in the winter colors. Yes, and she's also, you can ask, if you want to ask for her autograph, she does charge, I heard. Am I right, Carrie?
No.
Sorry.
No, I'm just kidding. Just got to get you guys a little smiling. It's a nice day out today.
It is.
Yeah. Does anyone have any questions
The
for me?
sun is shining.
Thank God.
See, I got a second emotion.
Yay.
Anyone else have any questions for me?
No.
Now, Teresa and Carrie, your fun time. Mr. Announcements.
I think we gave all our announcements.
No.
Yeah, I have Inclusive Services at the library has a bunch of events coming up.
Hey, Carrie.
I put them in the chat.
Name some.
So one that should be a lot of fun for school-age children is our compost program. We're going to be teaching people to make compost at home with materials they have around their house. Don't worry, it won't stink because we're going to do it in liter soda bottles. So join us for that. And the other programs, they're all, and our Music for Autism concerts. Find out more in the announcement section, as well as, right, our one-to-one assistance for parents dealing with navigating the systems. Thank you.
Someone.
Allie has a announcement.
Allie,
I know I have Allie and I have Sandy. And I know Allie was hand one up first. So Allie, go. Allie?
Yes, hi. Can you hear me? Sorry.
yes,
Loud
we
and
can.
clear. That's all I need to
Okay, great. I just want to remind everyone that so I am the clinical consultant at Anchor Health. Anchor provides home care services. One thing that I did hear was that families are really struggling right now, particularly with the children being in home and feeling like they need to work at the same time, and being able to juggle those two things. It also can be really stressful to just have the child in the home and have their resources and activities being, suspended and interrupted because of COVID. So we do have our health aides that can go in the home and provide assistance with getting them ready for the day, making food for them, sitting with them when they're doing the remote learning. We're Medicaid funded, so we're not through OPWDD waiver services. As long as they have Medicaid, we can provide services. And if someone is interested or has a family or an individual that could benefit from this, I'll put my information in the chat, and you feel free to reach out to me.
Allie, it's Teresa. What
Yes.
age do you start working with?
So it can be from infancy till, it really depends on the need. So if there's a medical need, it just depends on what the diagnosis is and what the medical need is. So for instance, we provide support for children who are like triplets or twins because, it's just difficult taking care of two babies at once. So there is no age limit as long as there's a medical need, and we can determine that.
Okay, so it's for medical needs.
Yes, it's for medical needs, but dealing with the IDD population, the need is there, right? It's always going to be there because people.
And if a parent doesn't have Medicaid but has private insurance, do you accept that?
So no, it has to be Medicaid, unfortunately.
Okay.
So I'm putting in my phone number and my email address in the chat box right now. And if anyone has clients, individuals or families that you feel like could use the service or benefit from it, you can reach out to me and I can help with the referral process.
1325@gmail. Okay, thank you.
Thank you.
Sandy Neighbor had her hand up.
You there, Sandy?
I am. Hi, everybody. How you
Hi,
doing?
dear.
Okay, I've got a lot of announcements as usual. And this one is a really good one. Family Connect through Adapt Community Network. We're having a free workshop for parents and professionals. And it's going to be conducted via Zoom on Wednesday, January 27th from 2 p.m. to 3:15 p.m. And the subject is going to be creating a calm and consistent home. And what's going to happen is that parents will be empowered to develop more efficient routines and expectations that everyone can follow and learn how to create a family atmosphere where everyone feels valued. And anyone who would like, this is open to professionals and caregivers. And anyone who wants to register can call 718-436-7979, extension 704, or they can email at familyconnect@adaptcommunitynetwork.org. And that's the first one, okay? And then I just want to address to Teresa that ADAPT does have home modifications openings, so that if anyone is interested in home modification services, they should reach out to Terry Wong, and she's at mwong@adaptcommunitynetwork.org, or 718-594-7374. And so anybody who's interested in that can reach out. And also we have family reimbursement in all 5 boroughs now. We only used to have it in 4, but now we have Queens as well. And they can, anyone who's interested can contact Project Connect at adaptcommunitynetwork.org, or call 877-827-2666. And I've written everything in the chat. So thank you very much, everyone.
Thank you.
Thank you, Sandy. Now, it's Doris, you had your hand. You're also next. You're on mute. No one can hear you.
Hey, thank you.
Yeah.
And thank everybody for the information we received today. I'm Doris Kahn from NYSID, that's New York State Institute on Disabilities. And we, listening to Teresa, she mentioned that families have increasing mental health issues at this time during this COVID, and we have openings for our crisis intervention services. The services right now are remote, and if they're interested, they can call Juliet Hawkins at 917-524-4856, or you can email Juliet at jhawkins, HAWKINS, at nysidinc.org. I put that information in the chat. I also want to say that NYSID, we have openings for remote evaluations for people to be eligible for OPWDD eligibility. And for evaluations, they can contact Elizabeth Sunshine at 917-699-0578, or email esunshine@nysidinc.org. I put both in the chat. I said at the last meeting, and some parents are reluctant to do evaluations remotely, and I want to emphasize that OPWD is right now accepting virtual evaluations, and parents should move forward and have the evaluation to the best of their ability so that the process can be moved forward and children could get their services from OPWD. Those are my announcements for today.
Doris, don't go anywhere, because I want to use, you just mentioned something, because at our last general meeting, and this also relates for Carrie and Michael, and if Kathy's still with us, I have no idea. But just to let everyone know, even Albany has said virtual, because they can understand if the family cannot go out.
Right.
Because if they're in a zone like Staten Island, between an orange and a yellow, it is not a problem. And I know Carrie will say this, if they have a computer. The only thing I got to remind them that you can try by phone, and they can understand, because people don't have this, and that's why I'm using my hands than my mouth.
What I have found, I just want to.
Go ahead. That's what I was waiting for you to say.
Something. What I have found, there is a problem with having internet access, with some of our families having internet access, but to get the evaluations, families have tried to maybe have a neighbor or other family member, an extended family member, and use their internet to get this done. Everybody's trying to do what they can to just get it done. So,
No, I understand. Yeah. And that's something that we may have to.
last resort, you can do it over a phone. Last resort. That's the last resort, though.
Okay.
And I actually agree with you, Doris. That's why I'm saying this for a reason, because if you don't have internet access or a computer or phone like this,
Right.
the next step is a landline phone, which is like, I'm going to use my surfing phone.
If you have a phone, you would have to have a smartphone. I mean, obviously.
Or an LG or something with a device.
Any kind of
Any kind of.
This is Carrie. I know you're trying to stand up here, represent Chris, but I just want to say that having a relative do it doesn't work because you can't respond to the emails. You don't have, even when I give people my husband's email address, he sometimes forgets to tell me, oh, you got an email, whatever. If it's somebody living, down the street or in a different state, this is not a solution. I'm sorry. I know that's not what you want to hear, but it just doesn't work.
No,
wait, but Carrie, remember, if an individual is going to be referred, the parent will be having to answer, especially if they're under 18.
Of course, Debbie, but
and I understand what you're saying, but at the same
you're not wrong.
time,
You're right. You're right.
Yeah.
that when it comes to being evaluated, the parent also counts just as much too this time, because many times our individuals cannot give an accurate assessment, and that causes problems.
Of course, Debbie. I'm just saying that if the parent doesn't have access and the individual doesn't have access to the internet, it isn't going to get done.
But Carrie, you're on the right track.
But we are trying, if last resort, if it has to be done over the phone.
Yes.
Because it must be done because of a time constraint, and that individual needs that service.
Right.
That it maybe has to be the way it's going to be done until we can go back to a more normal type existence. And that's the part, I understand that's what Doris is saying. It's the last resort. So we want the other things first.
Yeah.
But I even asked them at the Brooklyn DDRO, and I was told at last resort, yes, that if it has to be done, it has to be done that way. Now, I haven't about it, but if that's what has to be.
But Carrie, you're
we
actually
have to do a lot of documentation, but it can be done.
But Carrie, you're still right either way. It doesn't, whatever direction we go, it's still going to be a problem.
Right. Yeah, but having that ability to do it from a regular phone or from a non-smartphone is critical.
Yeah.
Yes, but unfortunately, that's what sometimes we're stuck with.
Yeah.
I can't get in touch with all my families either.
Yeah. It's important to be able to do that. Thank you. Sorry.
No, Carrie. No, Carrie, you're on the right track.
But we have issues. Where's Jack from William? Where's she from Tri-County? Are you still with us?
Michael's next.
Oh, I'm sorry, Michael. Apologize.
Michael from Roxanne, do you have any announcements you want to mention? Yes, you.
Yes, Michael. Yeah.
The handsome Michael.
No, just to thank you all.
Oop.
Wait.
Unmute. Okay. No, I just wanted to thank you for what you do on these meetings are but occasional, but for every participant, for what you do on a daily basis for very important community, to the senator and to all of us. So thank you.
And also just let everyone know, congratulations to Roxanne. Let me say that.
Roxanne Parrish, our
state senator.
Some of her new committee appointments will be.
Persaud.
Thank you.
Thank you. Will be. She's now on some new committees that'll be very, very helpful to this population.
Transportation is one. Developmental disability, which is a very important committee.
And what?
No, say it, Michael.
And she's chair of the Social Services Committee. She's the chairperson in the New York State Senate of the Social Services Committee. So
that's wonderful because
she's on top of all of these.
Yes, because I brought up issues to her, so I'll be letting you at another time know about that affects our individuals with Medicaid. She asked me to bring that up at another time. But I will.
But thank you, Michael.
Appreciate it.
Jessica Williams.
Okay. You're welcome.
Are you there?
Yes, I am here. Thank you, guys.
Here you go.
Good morning. This is Jessica again from Tri-County Care. I am an intake and outreach specialist, and I'm a representative of our large intake team. We are helping individuals and families with the full process of enrolling through OPWDD eligibility, helping families with Medicaid applications, also helping families to get their evaluations completed. We help families with all of the necessary processes to get them through the enrollment process so that they can receive a care manager. My information where you can reach me, I also put my information into the chat box. My email is there, my phone number is there as well. You can reach me at 844-504-8400, and my extension is 9298. And we're looking forward to helping all individuals, regardless of where they are in the process of getting OPWDD eligibility, whether they need a level of care. We are there to help the families and walk them through every process. And we're working closely with District 75, all agencies in New York City, Article 16 clinics. And recently, I'm focusing on Westchester areas as well. So if you know anyone in those areas and who would like information, please give me a call or shoot me a quick email. I'll be happy to give you more information. Thank you.
Does anyone have any questions for Jessica Williams? Because I see we have a hand up for her. Sandy?
I do, yes. Hi, Jessica. It's Sandy Naper from the DAP Community Network. How are you?
Hi, Sandy.
Hi. My question is, so you're saying parents who have just started to apply for eligibility for OPWDD, you will help them before they get eligibility?
Yes, that is correct. We are helping our individuals, whoever is being referred to us, it does not matter where they are in the process. If the parent has not even gone to the front door virtual yet, we are also helping families to get that information. We are working together with everyone. We have to do this collectively as a team. So if the parent does not have their eligibility yet, we are there to help with that step as well. We help with, number one, making sure that they have their front door completed. Right now, they're not doing certificates, but we need to get the proof that the parent did attend the front door. After that, our process is as usual. We're making sure the families have their evaluations completed, all the documents necessary so that they can complete their eligibility. Once they get the eligibility letter, we follow up on the level of care. Once we have a level of care, we follow up on the Medicaid. After the Medicaid, then we make sure that the family is able to be enrolled and we get the care manager assigned. We are helping with every single portion of the enrollment process. We are here to assist and help.
Did that answer your question?
That's great. That's very good to hear. I like that answer. Thank you very much.
Thank you, Sandy.
And just to add with Jessica, Character Design is also doing the same thing at this time. I cannot answer for the other one, but I only been hearing 2 CCOs at this time.
And we hope to see you tomorrow, Jessica, at the care coordination meeting.
Is that one tomorrow?
Yes, it is. We have Jennifer Schultz. I have Jennifer Schultz and special guest stars coming, especially for all these agencies who are here today on this lovely phone, a lovely video phone. So please be there tomorrow. This will give you guys some arsenal weaponry.
And you'll be able to.
And Michael, you're always welcome to come because we always welcome. It's an open. That meeting is open for the care coordination, and it is trying to make sure everyone gets the necessary information and how we can make sure that individuals, parents, and all staffs are getting the information they need on. GHO.
Hello.
GHO, hello. Miss Minnie Wong.
Mary Wu.
Mary Wu.
Hello.
Hello, can you hear me?
Now we can, yes.
I think Carrie can hear you.
I can.
I know I can hear you.
Oh, hi, good morning. This is Minnie. I'm family support assistant at GHO, General Human Outreach.
Yeah.
We provide family support service for all families with or without Medicaid. We have bilingual staff, Chinese and Korean. For family who have language barriers, we can assist them with OPWDD eligibility, Medicaid waiver, and all other service. We also have a contract with CDMY Care Design New York for intake and enrollment for family who have language barrier like Chinese and Korean. Thank you.
And Mitty, your
Yes.
agency, Mitty, does your agency just speak, you have people who can speak Cantonese, Mandarin, Taiwanese?
Yes, yes. Cantonese and Mandarin both.
And how about Japanese and Vietnamese?
Not yet.
Okay, no
Thank
problem.
you.
Thank you.
Does anyone have any questions for GHO? Okay, anyone else have an announcement? There is one person here. Who is AYE?
Hi, Ayala.
Ayala from?
From YAI.
Oh, sorry, I didn't recognize you because I'm used to seeing YAI or a different name.
Oh, yeah. Yeah, so YAI is the Young Adult Institute. They run lots of different programs for adults and children. So we have a bunch of groups that are still, that are starting up now in the spring season. So we have ballet, yoga, and social skills for children 4 to 12 with autism. We also have family reimbursement programs and free workshops, and we have independent living skills for adults 18 and up. And there's lots more information on the website, yai.org/link, which I will put in the chat now.
Thank you very much.
Does anyone else have a question for YAI?
No, but this is Teresa. Welcome. We always had someone from Links, from YAI, and we haven't had anyone for a while. So thank you for attending.
Of course, thank you. This has been really, really helpful.
Teresa, there was someone here last month for YAI. Last month.
Oh, sorry, I must have missed it.
It's hard when you're on the phone, dear.
Or the screen at the same time, couldn't tell where they
Yeah,
are.
because we couldn't find them either at first. But
Yeah.
I'm glad YI is here.
Yeah, but no, we appreciate a lot of everyone's here. Teresa, you have anything you want to add?
No, I just want to thank everyone. This was a lot of information, and I think it's going to be helpful for families and for GHO. I believe I have a parent for you. So I'm going to speak to the parent and give her your information.
Yes, thank you.
This is Carrie.
Go ahead.
Teresa, I hope you don't mind if I make a suggestion, but it would be nice to get a little list together, like an email group together of the people who are on this call and who want to stay in touch in between meetings. So if you email Teresa or me that you'd like to be, part of the, as I said, continue to stay in touch between meetings and get interim announcements about things like the programs and stuff, or help plan the next one. Shoot me an email or Teresa, and we'll set up a group.
You can
All right,
do it
Teresa?
together. Yeah, that would be very helpful.
Yeah.
We did in past have a list of different people that from different agencies, and we used to communicate regularly.
Yeah.
So that would be good to start it again. Thank you, Carrie.
Okay. Ayala
That
and
includes us parents too?
of course.
Because you didn't
Always
say parents. I
parents.
didn't hear the word parents.
Parents. Yeah, anybody.
Good.
I'd say individuals, but 3-4-year-olds, 6-7.
No, it's enough. I don't hear. I love them.
Not always
but not for this kind.
Yeah.
But I will be very glad to also assist because I do get lots of calls from families.
And just let everyone know, this information is also available on the Brooklyn Advisory Council's website. Because thanks to Teresa and Carrie, who do send us the schedule, Their next meeting is scheduled is February 9th, which is 2021. They will definitely let everyone know who's the next speaker on. And just to let everyone know, Teresa's email and phone number are both there. And Carrie, who put it on already on the chat, her email and phone number. You can always catch Carrie because she's always at this committee, the transition, and the general meeting. And very importantly is, please make sure you pass the word to get families and parents. And when I'm saying parents right now, and I'm going to say is we need the parents to come to these meetings to encourage them to help their future parents, because sooner or later, those young parents may don't realize that there are things out there and information can help them.
Yeah, one day we're young once, and then also we blink and we're not young anymore. And we do need, like I was encouraged and told by the generation before me, I'm telling the younger generation we need help.
Me too.
Right?
So please pass the word. Again, the website is always up to date, and if you even email Carrie Banks, Teresa, or the advisory council, you always get an email back at you saying when the next meeting dates. Like today, children's met today. Tomorrow is the care coordination, which Jennifer Schultz and special guest stars will be joining to solve the piece of the puzzles, which I'm going to
answer questions that many people have about HRA services.
Or others as well. So we will have bonuses on that. And does Teresa and Carrie, do you have anything else you want to add?
Thank you. I want to thank everyone for coming. This has been a nice meeting with a lot of good information shared.
We had 20 in attendance for the record.
20, okay.
Because it went up and now it went down. So
it's going up and down.
Yeah.
All right.
So does anyone else finally have to does anyone else have any questions before we say
goodbye? Say
have a good day and see you all tomorrow. See you next week.
And everyone
stay well and stay
healthy.
Thank you. Stay well. Stay well.
Okay.
Bye,
Thank you.
everyone.
Bye, everyone.
Thank you.
All. Bye.
Bye,
Have a good one.
everybody.
Bye.
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 Thank you, everyone. Thank you,
Thank you.
representatives of elected officials who came today.
Thank you.
Thank you for coming. Thank you, and we will support and keep us support.
Thank you, everyone. Have a good day.
You too.
Bye.
Bye.
Bye.